Is it time to refer your patient for liver transplantation evaluation? Consider the following. The majority of these patients will of course have cirrhosis. They'll meet minimal listing criteria once they've developed one of the complications we call decompensation. There are 4 main decompensating events that you must pay attention to. Number 1, ascites. Number 2, variceal bleeding. Note, this is not just the development of varices or the presence of varices, but actual bleeding. Number 3, hepatic encephalopathy. And number 4, which usually happens last in the evolution of this disease, jaundice. So if one of those 4 things are present, think about referral. The next thing to think about is what is the patient's MELD score. MELD stands for Model of End-Stage Liver Disease. It's comprised of the INR, bilirubin, and creatinine and must be plugged into a computer or calculator. Once the MELD score rises above 15, then that is a good time for a liver transplant. Before a MELD score of 15, we believe that the patient is better off with their native liver rather than a transplanted liver. Thirdly, think about other severe comorbidities before referring a patient for liver transplant evaluation. If there's been cancer any time in the past 5 years, that would be very concerning. Other organs that are failed, like heart failure, is also problematic, but keep in mind that kidney failure, even dialysis-dependent kidney failure, is okay, as the patient can receive a combined liver-kidney transplant. Lastly, consider the overall functional state of the patient and all of their comorbidities. Remember that transplants will take care of the liver disease, but not necessarily anything else. So if they have a very poor quality of life otherwise, then this is something to consider. Also, I should note age. That's a very common question. If the patient is less than 70 years old, they should be considered. And if they're 70 or above, they should be considered if they are otherwise in excellent health. Good luck.